What causes high sodium levels detectable by testing? Have you ever wondered why some people have high sodium levels in their blood? This condition, known as hypernatremia, can be detected through electrolyte testing. Sodium plays a vital role in our bodies, helping to regulate fluid balance, nerve function, and muscle contractions. When sodium levels rise above the normal range, which is typically above 145 milliequivalents per liter, it usually indicates an imbalance between sodium and water in the body. One of the main causes of high sodium levels is dehydration. This happens when the body loses more water than sodium, concentrating sodium in the blood. There are several reasons why dehydration can occur. For instance, not drinking enough water can reduce the body's fluid volume, leading to increased sodium concentration. Excessive fluid loss is another factor. Conditions like vomiting, diarrhea, heavy sweating, or excessive urination can cause the body to lose water and electrolytes. Often, more water is lost than sodium, which can lead to hypernatremia. Kidney dysfunction can also contribute to high sodium levels. When the kidneys cannot properly regulate sodium and water balance, sodium can build up in the blood. Additionally, the use of diuretics, which are medications that increase urine output, can lead to dehydration and elevated sodium levels if fluid intake is insufficient. Certain medical conditions can play a role as well. For example, diabetes insipidus causes excessive urination, while uncontrolled diabetes, fever, and burns can also contribute to high sodium levels. Altered mental states may impair thirst or fluid intake, further complicating hydration. Age can also be a factor. Infants and older adults are more susceptible to hypernatremia because their thirst mechanisms may not work as effectively. They may also rely on others for hydration, which can lead to inadequate fluid intake. While it is less common, high sodium levels can result from excessive sodium intake. However, the body usually regulates sodium tightly, making this scenario rare. Instances of too much sodium from intravenous fluids or salt poisoning are also uncommon and are typically monitored closely in clinical settings. From the perspective of hydration and electrolyte testing, detecting high sodium levels signals the need to assess fluid balance and identify underlying causes, such as dehydration or kidney issues. Managing elevated sodium often involves restoring proper hydration, frequently through carefully controlled intravenous fluids, and addressing any contributing health problems. High sodium levels detectable by testing primarily result from a relative deficit of water compared to sodium in the body. This is often due to dehydration caused by inadequate fluid intake or excessive fluid loss, with other medical factors also playing a role. Monitoring sodium through electrolyte testing helps guide appropriate hydration and treatment strategies.